Cognitive behavioral therapy, or CBT, is by far the most popular therapeutic intervention and the largest category of therapy interventions. And today I'm going to talk to you about what it is and what makes it so popular and powerful. Come on in, let's get started. Welcome. I am Dr. Tracy Dickens, a licensed clinical psychologist. If this is your first time here, welcome. I'm so glad you found the community. And if you've been here before, welcome back. Today I'm talking about cognitive behavioral therapy and what makes it so popular and powerful. In the over 20 years of doing therapy, cognitive behavior therapy is the most used intervention and body of techniques that I have used. And if you're wondering, what does that mean? So there's cognitive behavioral therapy, the actual structured intervention, which I'll talk about in just a minute. And then there are the various therapies that fall under the category of CBT. So some of the therapies that fall into the category would be therapies that impact depression, anxiety, substance abuse disorders, PTSD, exposure therapy if you have a phobia, oh goodness gracious, mindfulness, dialectical behavior therapy. I think I might have just said that, but you get the idea. The list goes on and on and on. It would just take up too much of the video. The thing that links all these techniques, it's the foundational piece of CBT, which says that our cognitions or thoughts impact our affect or emotions, and that impacts our behavior. When I talk with clients about this, I say, this is the ABCs of CBT. Our affects, behaviors, and cognitions influence each other. We know that there is a neurological link between our thoughts and our emotions. So if you start thinking about your grandmother's chocolate chip cookies, you will have an emotion. And when you become aware of that emotion, you are feeling it, you're actually experiencing it. And that experience of that emotion is going to prompt you to do something. It might be calling your grandmother. It might be looking at a photo album. It might be going to get chocolate chip cookies, but you're going to do something with that thought and emotion. The idea that thoughts and behaviors and emotions are connected is not new. The Bible says in Proverbs 23:7, "For as he thinketh in his heart, so is he." When you continue to go on and read that proverb, you can get a better idea that sometimes how we think and how we behave seem out of sync. For example, I can say I really care about my health, but yet you might catch me sitting at home eating donuts and Cheetos, watching Netflix. Doesn't really go in line with a healthy thought. But if you question me and really did some deep diving exploration into what I'm really thinking about myself, you will see that the behavior that you're seeing does line up with a deeper thought that I have inside that I may not even be aware of. And it's identifying those thoughts, the thoughts that sometimes we don't even know are there, but they still have an emotional impact and therefore a behavioral impact. And that's what we're looking for. The idea that thinking impacts how we feel and what we do showed up in the science community in the 1950s. Albert Ellis and Aaron Beck had similar epiphanies around the same time. Ellis believed that it was our irrational belief systems that fueled our behaviors. And if you identified the belief systems, you could change people's behaviors. Beck, on the other hand, believed that you could teach someone to analyze their maladaptive cognitions and generate more balanced or healthy thought patterns that could change someone's behaviors. But at the root of it, everybody recognizes that it's how we think about situations and ourselves that ultimately impact what we do and how we feel. This recognition sheds light on how two people can experience the same event but have a different experience of that event. For example, we can have two people watch a house burning and one person can develop trauma and the other person is anxious for a little while and then recovers. And you think, okay, they both experience the same thing, but they didn't. What they thought about the house fire is going to be very different. One person may be thinking, I just lost everything in that house. Oh my gosh, how am I going to recover? Where the other person is thinking, oh my goodness, I'm so glad we made it out alive and we can replace the things that are in the house. I'm so glad we have homeowners insurance. And so same event, different thoughts. And because of those different thoughts, they're going to have different emotions and they're going to do very different things. CBT as an intervention tends to be a very structured intervention. The client comes into the session, the clinician and the client generate an agenda for the session, and the agenda will generally revolve around what is written on the CBT conceptualization sheet or chart. This chart is a result of conversations with the client that identify significant events in the client's life. And those significant events are then explored to a level where you can identify the core beliefs that a client might be operating from. And then from the core beliefs, you get at recurring thoughts. And from the recurring thoughts, you look at the interactions. I'll give you something concrete so this makes sense. So a few years ago, I had a client that grew up in a home with a father that abused alcohol and would become violently abusive whenever he would drink excessively. So my client was the oldest of 3 children, and whenever his father would start drinking excessively and getting violent, he would get his younger siblings, put them in the closet, and talk with them and read stories to them and hold them and console them. As my client got older and his father's violence got more extreme, he started thinking of ways that he could just stop the violence altogether. And so one night when his father was being particularly abusive to their mother, he decided to intervene. And the result was my client was severely injured, as was his mother. And my client thought that he was responsible for how everything unfolded. And there was a series of things that occurred to the family after that. In session, as we talked about this traumatic event, we recognized that he was operating from this belief that he was a failure. In his mind, in his 13-year-old mind, he was convinced that he could have stopped this violence, and the fact that he didn't and was severely injured really left an impression on him. And so he operated from this place of he was a failure and a disappointment to his family, and he would always be a failure and a disappointment to his family, regardless of the evidence that said otherwise. That is the core belief. So then you have the recurring thought that I'm a failure, people are disappointed in me, I'm not a good father, I'm not a good worker, I'm not a good husband, I don't know how to be those things, I can't be those things, I'm always going to mess these things up. Ultimately, these thoughts then show up in his interactions. And so what ultimately brought him to therapy was he had gotten feedback at work from a yearly review, and his supervisor mentioned one thing that he needed to work on. The client heard it in this very harsh tone and thought that he was about to lose his job. We start to, talk about the different interactions and helping him kind of slowly kind of analyze the evidence that's actually happening in the events versus what he's telling himself is happening in the events, and connecting it to this core belief, and then processing ultimately that trauma and helping him recognize that, a 12, 13-year-old boy only has so much power and control over an adult male who is abusing alcohol. Cognitive behavioral therapy as just the intervention will do that. Whether it's very structured or a little more malleable with some various other techniques and concepts thrown in, cognitive behavioral therapy is going to look at your thinking. Hearing that scenario, you probably think, wow, cognitive behavioral therapy sounds really great. And it is. It really gets at, some of the things what we're thinking. It can change behaviors. It can reduce stress. You can use it for all ages. I mean, I've used cognitive behavioral techniques with children when I worked with children and families. You can use it with people as they get older. There are some limitations with that I will talk with you about in a minute. But it's an effective approach. I mean, people do see improvement with cognitive behavioral therapy. And it sounds almost too good to be true. Like, yes, sign me up. And it's really great, but it does have limitations. It's not a perfect intervention or a body of interventions. And this is why. I can tell you as a therapist, when I have gone to therapy, I specifically want a clinician that is going to use something other than cognitive behavioral therapy techniques with me. And you think, okay, if you like it, why won't you use it? Well, this is why. I am a thinker. I am in my head a lot. And if I am working with a client that I know tends to be in their head and they're very logical and they want to reason through their emotions and they want to make sense and they want it to all line up and be just so, I will intentionally do something different to get them out of their head because I want them to actually experience their emotions and not think their emotions. And same for me. I know I'm a thinker and I can think up really good balanced thoughts. I can think of things that I should be thinking, but I don't really believe them. Yeah, I can make it sound really great, but I won't believe it. And that is also part of cognitive behavioral therapy, is checking to see if the thought that you are producing is something that the client actually believes, because a lot of times we know what people are expecting from us and we want to produce that. We want to be successful. It can look like we're making progress, but we're really not making progress. Number 2, when there is trauma involved, it's really hard to start with how a person thinks. The very nature of trauma, it is an experience that does not involve logic. It is sensory and emotionally experienced. And a lot of times it's beyond verbal explanation. And in the future, I can do videos about trauma and how it impacts us and how it's processed in the brain so you can better understand. But when we have an experience that is so sensory and emotionally heavy, it is hard to think through that experience. And so the first place to start for trauma is generally going to be helping people start to feel safe and have mastery over their sensory experience so they can get to the logical experience. The third, cognitive behavioral therapy may not be the best approach, is if there is some form of cognitive disruption or deficit. So this can mean if the person has dementia or has a lower level of cognitive functioning. It can be challenging to move them through CBT, because kind of the hallmark of cognitive behavioral therapy is being able to have like this meta experience of your thoughts, to think about your thinking. Another caution is that cognitive behavioral therapy takes time. It's not something you're just gonna run in and do and magically be better. Sometimes people can get relief pretty quickly, but even when you go at the core beliefs, you can find that you circle back to the same beliefs because it takes time. Because generally, like I was saying earlier, you may come up with a core belief, but you may not really buy into it. It takes time to see yourself in a different way and really start to believe that you are different than what you have been believing about yourself. So that just takes time. Thank you so much for hanging around to the end of the video. I hope this information was helpful for you. And I want you to know that I plan on looking at thought distortions in the upcoming weeks so I can unpack the different ways our thinking kind of settles into core beliefs and different activities and skills that you can use to get those core beliefs out of there so you can live a more fulfilling life. If you like the information in the video, push the likes, thumbs up, and subscribe so you can come back and catch those future videos about thought distortions. And until next time, choose joy and take care of yourself.